Let me talk about aging. There is a lot of perspective on aging. Dr. Sinclair says that aging is a treatable disease. I really agree with him in terms of appearance and body function. It is true that the second half of life is not functional and comfortable as it should be. I think the problem is that none of the topics on aging concept in detail the changes in the shape of the face and body. Isn't it possible that it is not the aging process that causes the loss of the shape, but rather the changes in shape that lead to the variable symptom of aging? I believe that the process of getting into the shape of the elderly can lead to many diseases. Based on past my experience, I would like to talk about what is fundamentally responsible for losing shape. First of all, let me introduce myself. I'm Yuka Kurokawa, 58 years old, living in Kyoto, Japan. Let me give you a brief background. When I was 22 years old, I had a car accident that left my face badly damaged. And I underwent plastic surgery 89 times in hospitalization for about 3 years. I underwent transplant and reconstructive surgery at Kyoto University Hospital, where the famous Dr. Yamanaka is a member. Of course, he was not there at that time. He was still in a medical school. After about 3 years of treatment, I started working in the cosmetic field. In the beginning, I focused on beautiful skin, but gradually I started on work on the shape of the face. Why did I work on the shape of the face? Because I thought that the deterioration of the shape was important for the face as a prerequisite. After the facial plastic surgery, which done perfectly well, but the deterioration of the shape of my face and my bad physical condition in the long years that followed. In short, the accident caused me to age faster. Now my appearance has become quite normal, but when I have X-rays or CT scan, the doctor in charge are amazed. My facial skull is pretty messed up. With the experience of the accident, I was able to understand the meaning of aging. Well, for me, with such a background, I didn't know how to link appearance, aging, poor health, accident experience, and its treatment. I didn't know how they were linked at that time. What was my physical condition like? I looked fat, like a pregnant. I couldn't straighten my body. I felt like an old woman with a bent back. I was extremely tired. I felt lazy. I couldn't wear my favorite high heel pumps. I couldn't even wear normal shoes. I had to wear shoes for the elderly. In place where I had to wear it, I left my shoes in the cloakroom. It was hard to pick up things that had fallen down. I had a headache. My head was always foggy and I couldn't think clearly. I couldn't maintain my body temperature and I slept with the strongest electric blanket even in the middle of summer. Even when I lay down on the bed, my body ached so much that I didn't even feel like resting. I had been taking various medicine because I was not feeling well. In short, I was an old woman. This is a picture of the opening ceremony of my new store and the celebration 22 years ago. I was 36 years old at that time. Recently, people who watch the photo say, "Is this your mother?" When I put the photo together, it's obvious that I'm getting younger now. In fact, there is a clue in this picture as to whether I'm aging or not. Yes, my job now is to rejuvenate the shape to health. Some people really can't accept their aging and are suffering a lot. Why does people's shape change? It is not only because of age. There are many factors that can make a person look old and even lead to poor health. You never imagined that the change in shape could lead to poor health. In this video, I would like to introduce my efforts to control the shape of the face and the body after suffering from that. I will talk about variable aspects of shape, facial shape, body shape, and body function and aging, and what I am using to control the shape. Let me give you a brief introduction at the beginning. The function of the skin, then based on the idea of mechanobiology, ectoderm changes during embryogenesis and subsequent processes, and body surface nerves distribution. I have been looking at aging in my own way for 20 years from the perspective of shape. I have been able to control the shape of the body without using any machines or mechanicals, even muscle training, just by my making small changes in my daily movement. I'm able to control the balance of the body and health now. I will also talk about effects on the body functions and how they are linked to the aging processes. The other day, I read Dr. Sinclair's Lifespan. I also watched many videos on YouTube. It was so amazing. In my experience, I secretly thought that aging is quite controllable in a sense, but I kept quiet about it because I thought that if I talk about it, people would say I was crazy. But what Dr. Sinclair said made me feel a little better. The reasons why each and every disease increases is that something is happening upstream of it, and we have to deal with it. I think there is someone who could finally say such a thing. Please listen to what I have to say. If you are trying to break aging, you need to understand first. I've already studied English for this video. Please forgive me if my expression and tone is strange. First of all, let me talk about the aging of shape as I see it. Shapes really do change, don't they? When people first become an adult, the body shape is straight and thin, but then they gain fat in the strange area, their long legs become short, and the compact torso becomes wide. The muscles that used to be strong and compact becomes weak and broad. The head that used to be small increases the size, and the shoulders become hunchback. The muscles that have grown so large are no longer functional, and the elderly can't even maintain their own balance. The elderly can't move their body as they want. It's like a different person. Don't you feel a contradiction? It's as if zombie-like tissues have sprung up in the human body, and beautiful body shape has collapsed like a molten lava floor. You may think it's fatness, but it's totally different from the fatness of a young person. It is necessary to recognize that the changing of the shape and gaining weight are very different things, although they have similar means. There is no stopping the road to an aging without stopping non-functioning figure. If you were young, healthy, and beautiful, and you suddenly got to the elderly shape, you might go crazy with the pain. You would feel discomfort, pain, and suffering as you are forced to take that shape. And since people have no concept of it being a deformity of the face or body as a disease, they have nowhere to turn for help. I have experienced a more severe and rapid shape of aging than most people, and I have arrived at one of the major answers to what accelerates this deformation in our daily lives. And to do that, we need to know what the young shape looks like and why it becomes the elderly shape. We need to define the normal and original shape and its arrangement. It may be fat, thin, straight, crooked, etc. But there is more fundamental perspective. I believe that it is very important to be in a correct position relative to the body axis. I believe that is fundamental. The axis of the primitive and simple creature's shape is the digestive system. For the structure from the mouth to the anus, it is very important that the correct surrounding tissues are not out of their original arrangement. If the positioning is deformed, even the function will be affected. In thinking about original shape, it was necessary to quote the concept of embryology. Let's look at our body from the perspective of three layers: ectoderm-derived, endoderm-derived, and mesoderm-derived. When I check the surrounding tissues, the mesoderm-derived tissues are already too complicated to capture, but the skin of the ectoderm, it is a single seed. It is underpinned by the distribution of body surface nerves. And even if the overall shape of the body is collapsed and the position of the skin shifts, it does not impair the positioning of most heads and tails very much. More specifically, it means the position of the mouth to the anus. I use the skin as a marker of shape to identify distortion and deformities. The skin is the only landmark because no matter how much it is distorted, it's distorted while retaining the original connection. In short, arranged in order around the axis. I can't confirm where the other tissues are, but the skin is the only part of that shows me with a clear picture of its position. Therefore, my shape of controlling treatments and skincare are viewed from the simple perspective of skin and axis of the digestive system. The purpose of my treatment is to control the position of the skin, to shrink the spread skin and its flexibility. By being aware of the positional relationship of the endoderm-derived tissues, I can correct them in the skin in a certain range. Naturally, the digestive system, which is the axis of the body, also loses its shape, adversely affecting the overall shape of the body. I note that endoderm-derived organs include not only the digestive system but also the respiratory system and other organs. But I consider the digestive system as the axis on behalf of them. The skin distorts the axis and the axis distorts the skin. In conclusion, in the sense that it is very influential to the body shape, they are interlocked. Here is an example of tissue distortion of the axis. A simple example of this would be a hunchback and a bulge in the lower abdomen. And no matter how much diet or muscle training the elderly go, they will not be able to regain the balance they have when they were young. The elderly who suffer from this kind of distortion consider that as a result of their age, which causes the metabolism to slow down and makes it harder for them to lose weight. That will not stop aging process no matter how far they go. This way of thinking is an obsession with the basic shape of creatures. In both the primitive creatures and the evolved human body, the axis of the digestive system covers the tissues from the inside and the skin from the outside. In other words, the tissues that make up most of the body are supported in the position by the inner axis and outer skin. Now that I'm looking at it from this perspective, it is much easier to control the shape of the body. Even primitive creatures without complex structures are able to provide nutrition and metabolism without difficulty. I believe that humans who have become more complex in order to have higher functions must work even harder to maintain their original shape, or they will suffer from variable adverse effects and find it difficult to maintain a healthy state. This is the basis of my view of aging from the perspective of shape. It's really coincidental, but my perspective stems from a facial leg. The deterioration caused by the addition of aging to my once damaged face, I was afraid that, and my perspective was gained as a result of continued strong interest in the shape of the face. At first, I had no idea that the shape of the face could have such a great influence on the shape of the body, the health, and even aging. However, the more my face returned to my original undisturbed state, the more my body, health, motor function, and even my mental state began to adjust. This is me at the age of 58. It is as if time is rewinding, and the fall atmosphere is become more useful. Of course, it's obvious that I'm 58 years old, but compared to when I was 36, my relaxed and natural appearance makes me look younger. I'm able to stay active all day long wearing pin heels. The heels don't tire me out at all. So why does the shape of the face affect the shape of the body and function? I told you that the endoderm and ectoderm maintain the shape of the body. Endoderm and ectoderm are never directly connected, are they? This is the story of the embryology, except for the mouth and anus. I assume that the mouth and the face around it are the starting point of the shape. Here is a diagram that greatly influenced this theory of my treatment. Feeling that I had to think of shape in terms of skin, I became interested in the ectoderm, the origin of skin, and saw this picture. The mesoderm is sandwiched between the endoderm and the ectoderm. The endoderm and the ectoderm are connected by the mouth and anus. And in the fate plan of this embryo, the first facial part occupies the fall. This is a page of the basic principles of human embryology at Ehime University School of Medicine in Japan. I was sure that my facial leg caused aging. I strongly believe that if I forgot this origin and thought about the shape of the face, I would never get an answer. The face is kept soft by special muscle called facial muscles. The useful shape of the face, raised and supported with the soft tissues, fulfills its function. A normal and undistorted face is not only beautiful, but also feels like it controls the normal shape of the body and the tissues are connected and positioned. When we talk, eat, chew, or laugh with emotion, these natural movements are potentially stimulating the body. In order to understand the soft and normal shape of the face, I ask my client to touch in front of my stomach and see how the skin shakes in conclusion with the blink. I make sure that the client understands that the normal movement of the face has a role to play in activating the entire body with constant micro vibrations. But this is not the case if the face shape is collapsed, like a car is about to come off the wheels. Even a slight movement causes the whole body to vibrate in a disturbed way. This disturbed vibration is one of the negative effects on the body. Observe the movement of the elderly's face. The parts of the face don't mesh with each other anymore. The movements are not smooth. You may not even question it because that's how old people are. I believe that this distorted face movement is what affects the body. As I have experienced a lot of aging in my 30s, I felt I'm nearing the end of my life. The way of my movement was like an old woman. The axis and the skin were already distorted and changed to that angle. Have you ever heard of mechanobiology? Dr. Sokabe of Nagoya University School of Medicine in Japan has been studying for almost 20 years or more that cells quickly change their shape depending on variable environmental factors and mechanical stimuli that occur inside the body, such as the rhythm and direction of the blood flow. If distorted, the stimuli needed by the cells in the body will become collapsed. Aneurysm, a typical example of this. The irregular vibration occurs by the disturbance of blood flow can cause aneurysm. There are many environmental factors, for example, gravity being one of them. If the body shape is distorted, the gravitational force will change the direction of the stimulus to the body. For example, a knee joint or lumbar spine that is said to have a vertical gravitational stimulus will have an inclined induction of the cells or their shape due to the constant oblique stimulus. It is easy to imagine that the chain of mechanical stimulation of the strain will also chain to each tissue. However, it is hard to imagine that the distortion of the body is caused by the distortion of the digestive system and skin, which creates the forward-leaning posture peculiar to the elderly, and the gravitational force vector on the knee is not what it should be. So why are humans the only ones with so many diseases that prevent them from living a full life? This is my question. I believe it is because we are the only ones who take care of our skin without thinking about what it means or how it affects us. Have you ever touched your skin to imagine how instantly it sends signals to the body when it sends the outside? Especially the soft tissues of the face, which is a special part of the body, invites the deformations caused by routine skincare movements and ingredients. It is perspective of the shape, not the perspective of the beautiful skin. It also has a very pronounced reaction to movement, temperature, water, soap, and ingredients. Other creatures don't have intelligent skincare and don't bother to take care of themselves unnecessarily. Of course, people in the past, when they didn't take care of their skin, also had a more pronounced deterioration in the shape of their face than other animals. I believe that direct exposure to the open air and sunlight on the bare skin has a significant effect. What is the difference between the natural lifespan of other species? Isn't it whether the stimulus applied to the skin has a negative effect on the body's functions continuously in everyday life, especially to the face? Isn't it possible that the reason some species of sea creatures can live so long is because the necessary and good stimulus of seawater is always present on their skin? The skin is a single membrane. It is very important to maintain the set body shape and position of the skin. In short, it is prerequisite to maintain the normal spread of skin area, hardness, and skin function. All have a direct impact on internal structure. It is how much we unconsciously take care of our face and body that makes us look like the elderly, as a matter of course. You can see that the skin expanse of an 80 years old is not the same as the skin expanse of a 20 years old. In any case, don't you feel the compatibility between the skin area and the size of internal structure, even if the cause of the consideration is different? In any case, the bare skin is influential to the body. As the skin area expands and hardens, the internal structure distorts like a creek. No matter how much your posture and your shape deteriorate, the connection from skin to internal structure will be handed down no matter how many times you divide your cells. Look at this other example. This is a picture of the moment when the left side of her face was first shaped by my skin induction for about 15 minutes. Even though I only touched her face, the balance and shape of the body changed. The shape of the face is naturally shaped, but the width of the shoulder, the size of torso, the position of the waist, and the thickness of her leg all work together. This phenomenon is not limited to this person, but occurs in most people. Let's go back to the everyday causes of aging. Here is my observation. People wash their face, body, and hair, right? The skin exquisitely covers our three-dimensional structure. When each of these wash is done, you would never guess how much of effect it has on the inside. I know it sounds like a crazy theory, but it's actually happening. Look at also this picture. This is the before and after of 10-minute skincare treatment. The simple act of washing and moisturizing her face has the power to make such a difference. You can see the difference in the straightness of her legs, the curve of her back, and even the size and position of her buttocks. She also said that her hip joint, which she had felt pain, was very comfortable and could be moved without pain. This is a phenomenon that can easily happen to anyone, not just this person. Controlling the shape of her face and body is all about skin guidance and skincare. Why do we wash our faces and bodies? Because that's what we learn from our parents. Skincare, bathing, etc. are somehow handed down from generation to generation. I have observed that this is the reason why people who grown up in the same environment tend to look alike. The Japanese have longevity partly due to our diet, but also due to our habit of bathing carefully every day in a unique way. Don't you think? I think that is a hint of fountain of usefulness. Skincare, for example, the moment you wet your face, the moment you dry your face, the moment you apply cleanser, the moment you feel temperature. Your face receives instruction and changes the shape at every moment. It's the same with the body. Based on the hypothesis that there must be a chain of events in the internal structure of the body at each moment, I try to change the shape of the body and return it its ideal shape through the skincare I performed. You wash your face and body with your own particular routine without thinking about the effect. Isn't this one of the main reasons why we age our shape and thus inhibit variable normal reactions? As the legend goes, skin metabolism has a 28-day cycle when people is young, but it slows down with age, and the rule of thumb is that it should be added 10 to 15 days to their age. This in itself is one of the clues to the aging factor, considering that it is already linked to the internal structure, isn't it? If the researchers are thinking about aging, I urge them to examine the efforts of the shape. I have experience in this area, but I don't have equipment to examine that. I'm also currently trying to track the effect of cosmetic ingredients on the body's shape. I have seen countless times how the ingredients can affect the shape of the body. When people combine movement and ingredients in a routine, the shape of the face and body are influenced. As long as you get it right, skincare is very effective anti-aging treatment for shape. If the shape changes, the reaction in the body should also change. This much is truly certain. It is not an exaggeration to think that anything you do to your skin is directly shaping it. Currently, I'm in a more comfortable state of health and mentally motivated than I have ever been in the past, even when I was young. I hope that people who are dealing with aging will adapt this perspective on the skin. Thank you for watching until the end. See you in the next video.